that you can then share with your consumers. So moving on to costs associated with health insurance. Again, going on with some of the terminology. We've got four here. We've got premiums, we've got copayment or copay, we have coinsurance and deductibles. Premiums, the amount we pay, usually it's paid monthly, quarterly, yearly. Right? The copay is the fixed amount that you pay at the time of service. Coinsurance is the consumer's share of the cost of a covered healthcare service, and it's calculated as a percent of the amount allowed by the health plan for that service. And a deductible is the amount the consumers owe for healthcare services before the health insurance plan begins to pay. Again, just breaking it down for you. So, in this one, I'm not going to read this little story. I think you can read that. But this basically is if a person has managed care, let's say he doesn't follow the advice of the doctor or his nurse practitioner, and goes to a hospital that's not in his managed care network. So what percent will he have to pay? I'll repeat that. Let's say this gentleman here goes to a hospital that's out of network. How much would he have to pay? 20%?
Depends on the plan.
That's why you're getting a plan.
But let's say he's on an HMO and he goes out of network. All of it, right.
But you can also get prior authorization.
If he gets prior authorization, but in an HMO, usually it's in network. Should be in network. So, but yes, it's a good point. Is prior authorization. So basically, it's not choosing yourself, but talking with your medical practitioner, whether it's your doctor, the nurse practitioner, just to make sure that you're in network. But even before that is before you choose your plan, to make sure your plan and your providers and any specialists you use are in your network. That helps you to make the informed decision when you're choosing your plan. So on this slide here, this basically, how many of you are familiar with cost sharing? Okay, some of you are familiar with cost sharing. This slide is a little busy here, but basically this explains a little bit about cost sharing. In this first section, Jane has a $1,500 deductible with her plan. Okay, she goes to the doctor. She pays an office visit. Her office visit costs $125.